So good day po, ma'am, sir. I'm Amir Alexa Almatias, a Level 2 nursing student from Holy Angel University, and today I will be demonstrating po how to assist with newborn care. Now, throughout the procedure, I just wanted to clarify that I'm just using the materials that are available to us at home, but these are just serving as means for us to practice before reenacting it in the nursing arts laboratory and in our clinical duty. And also, I want to give forewarning that I may not be able to be seen throughout the whole video due to the angle in which I am filming, but rest assured that I am the one who is conducting the whole process of this video return demonstration. Thank you. Okay, so I have already prepared all the equipment that could possibly be needed during the whole procedure. I've also performed my hand hygiene and donned my gloves prior to this procedure. And now I'll just be getting the baby and then laying her here flat on on the linings. And then we can get started on our actual procedure proper. So now that our baby is here, what we're gonna do first is that we're going to make sure that there is an established patent airway, because we have to make sure that there's nothing obstructing the airway. However, we also need to avoid suctioning as much as possible. Now, as I can see, there's nothing hindering or obstructing the airway of the baby. And then we have to make sure that that the baby is wrapped in a thoroughly dry blanket for it to keep the baby warm. And if needed, we can cover the baby with a cap or a bonnet in here. And then what we're going to be doing is we have to remove any form of wet linen if there is any, but as I have observed here, the baby is already dry and the wet linen has already been discarded by the previous nurse. And if needed, or if there's more adequate light needed, we will be placing a drop light if necessary. Now, we're going to be proceeding immediately, and 5 minutes after delivery, we're going to be performing the APGAR scoring, because it is important that we are going to be evaluating the functioning of the baby's central nervous system. So I have here my small notebook together with my ball pen. So, activity. Okay, we're gonna give, and then pulse rate. Grimace and appearance. Okay. Now for the respiration. Alright. Now, for identification purposes, we're going to be putting a form of a wristband on the baby's hand. So I'm just going to be exposing the parts that's needed. Then after that, as per the hospital policy, we're going to be conducting the footprint here on the baby just for identification purposes. So we're just going to be exposing the parts that's needed. Placing. Now, I will be getting my tape measure, because now we're going to be doing the anthropometric measurements, including the height. So we have here the baby's height, and then its weight, and then together with its head measurement, circumference. The guide is the eyebrows, and then the chest along the nipples, and then the abdominal circumference. And we're going to be taking note of that one for documentation purposes. So now that we have documented the measurements, now we're going to be applying creed prophylaxis on both eyes. But we also have to make sure that that whatever we're using, it won't touch the lower eyelid of the baby. And then now is the time that we're also going to be checking for anal tendency. Alright. Now, as per institutional policy, I will just be giving the baby either a water or an oil bath. Right, so now the baby is done with the bath. So now we place back its bonnet. And then we make sure that we're going to be putting on the baby's clothing together with its diapers, mittens, and socks. So for the meantime, I'll just be placing the baby's mittens, or the socks rather. Alright. The other one. Alright, so now after we have gotten our baby dress, it is important that we are going to be administering vitamin K, and in some institutions, they also allow for the administration of BCG and HIB. However, this is still depending on the doctor's order for us nurses. So now to the lateral inferior thigh, right, and 1, 2. And now we discard. Now I'm going to be assisting the baby as a new nurse is going to be taking charge of taking care of the baby, and then I'm going to be proceeding to the post-procedure tasks. After the procedure, of course, we must make sure that we're going to be disposing all of the contaminated materials into its proper waste bins. And then I'm also going to be decontaminating the instruments that I have used so that the instruments will still remain sterile as per hospital protocol. And now I'm going to be getting rid of my used gloves. And then I'm going to be disposing them. And then I'm going to be performing hand hygiene again through hand sanitizer. Now I'm going to be documenting all of the information that is needed together with all the procedures and the interventions that I have done throughout this procedure. And that concludes how I would assist for a newborn care. So thank you so much po, ma'am, sir, and I hope you have a great day.